Have you ever thought about what happens when you get sick? It's a question that often lurks in the shadows of our minds, yet it's crucial we bring it to light. Our health is our wealth, and understanding our health insurance options is as essential as the air we breathe. As we venture into this conversation, we'll delve into the intricacies of traditional Medicare and Medicare Advantage plans. Because when it comes to your well-being, knowledge truly is power. It's vital to have a comprehensive understanding of your health insurance options. Traditional Medicare, also known as Original Medicare, is a government program that provides health coverage. It's like an old friend, reliable and steady, and it's been around since the mid-20th century. But what does this friend bring to the table? Traditional Medicare is made up of several components. Part A, or hospital insurance, covers hospital stays, care in a skilled nursing facility, hospice care, and some home health care. If it's hospital-related, chances are Part A has got you covered. Then there's Part B, which is medical insurance. It covers certain doctor's services, outpatient care, medical supplies, and preventive services. Think of it as your shield against the unexpected, ready to step in when you need to see a doctor or get medical services. And let's not forget Part D, the prescription drug coverage. It helps cover the cost of prescription medications, ensuring that the pills you need don't burn a hole in your pocket. Now, traditional Medicare sounds pretty great, doesn't it? It's widely accepted by doctors and hospitals across the country, which means you'll rarely be left stranded without coverage. But like all good things, it has its limitations. One of the biggest is that there are no maximum out-of-pocket limits. This means that if you have a serious health issue and require extensive treatment, you could end up with a hefty bill. Another limitation is that it doesn't cover everything. For instance, long-term care, most dental care, eye exams related to prescription glasses, and cosmetic surgery are not covered. Also, traditional Medicare doesn't cover the cost of prescription drugs unless you purchase a separate Part D plan, so you'll need to factor in the additional cost for this coverage. But despite these limitations, traditional Medicare provides extensive coverage. It's like a safety net, there to catch you when you fall. It's a complex system, but it's one that millions of Americans rely on for their health coverage. Traditional Medicare provides extensive coverage, but it's not without its drawbacks. So, as you navigate your healthcare journey, remember to weigh the benefits against the limitations. After all, knowledge is power when it comes to your health. Medicare Advantage, also known as Part C, is a private insurance alternative to traditional Medicare. Now you may be pondering, what does this mean for me? Allow me to shed some light on this. Medicare Advantage plans offer a unique structure, one that often includes Medicare Parts A and B, and sometimes even Part D as well. Think of it as a bundled package. Part A covers hospital insurance, Part B provides medical insurance, and Part D is for prescription drug coverage. With Medicare Advantage, you usually get all these in one tidy package, which can simplify your healthcare experience. But there's a twist. While traditional Medicare allows you to see any doctor or hospital that accepts Medicare, Medicare Advantage may limit you to a network of doctors and hospitals. This means your favorite doctor or the specialist you've been seeing for years might not be included in your network. It's like going to a buffet but only being allowed to eat from certain sections. Now let's talk about the benefits. One of the major selling points of Medicare Advantage is its all-in-one structure. This means you don't have to juggle multiple plans or worry about coordinating benefits. Additionally, Medicare Advantage plans often include extra benefits not covered by traditional Medicare, like vision, hearing, and dental coverage. However, it's not all sunshine and rainbows. Medicare Advantage plans can limit your choice of healthcare providers and may require referrals for specialist visits. Plus, if you travel frequently, coverage may not extend far from your home area. In terms of costs, Medicare Advantage plans often have lower monthly premiums than traditional Medicare, but they can also have higher out-of-pocket costs. It's a classic case of less now, more later, or vice versa, depending on your healthcare needs. So, what's the takeaway? Medicare Advantage offers a different approach to health coverage, but it's not for everyone. It's crucial to assess your own health needs, preferences, and budget before making a decision. Remember, healthcare is not one size fits all. While both traditional Medicare and Medicare Advantage can provide robust health coverage, they differ in significant ways. Understanding these differences can help you make an informed decision about which plan is best for you. Let's start with cost. Traditional Medicare often has higher out-of-pocket costs without a maximum limit. However, it's generally more predictable with a set premium, deductible, and co-pays. Medicare Advantage, on the other hand, could potentially save you money, as it often has lower premiums and a cap on out-of-pocket expenses. But remember, cost isn't everything. In terms of coverage, traditional Medicare covers hospital and medical services, with the option to add prescription drug coverage. It doesn't typically cover routine vision, dental, or hearing care. Conversely, Medicare Advantage plans are required to cover everything traditional Medicare does, plus they often include additional benefits like vision, dental, hearing, and even wellness programs. Next, let's talk about flexibility. With traditional Medicare, you have the freedom to visit any doctor or hospital that accepts Medicare, which can be especially important if you travel often or live in multiple places throughout the year. Medicare Advantage plans, on the other hand, usually have a network of providers. You might need to choose a primary care doctor and get referrals to see specialists. Convenience is another factor to consider. Traditional Medicare involves coordinating between multiple parts: Part A for hospital coverage, Part B for medical coverage, and potentially Part D for prescription drugs. You might also add a Medigap policy to help cover out-of-pocket costs. Medicare Advantage simplifies this by combining everything into one plan. Now let's discuss suitability. Traditional Medicare might be a good fit if you want flexibility in choosing your providers, if you travel frequently, or if you're willing to pay more for predictable costs. Medicare Advantage could be a better choice if you want a broader range of benefits, prefer having all your coverage in one plan, or if you're willing to navigate a network of providers for potentially lower costs. In summary, it's not about which plan is better overall, but which is better for you. Traditional Medicare offers flexibility and predictability at a potentially higher cost. Medicare Advantage offers a broader range of benefits and potential cost savings at the cost of less flexibility. The best choice between traditional Medicare and Medicare Advantage depends on your unique health needs and circumstances. There are facts about health insurance that companies prefer to keep under wraps. Firstly, let's talk about out-of-pocket maximums. These are the limits on how much you have to pay for covered services in a year. Once you reach this limit, your insurance company pays for all covered services. However, not all expenses count towards this maximum. For instance, your monthly premiums and any services or prescriptions not covered by your plan don't add up to this limit. This can lead to unexpected costs, so it's crucial to understand what counts and what doesn't. Next, let's discuss surprise medical bills. These are bills you receive for services you thought were covered by your insurance, but aren't. They often occur when you receive care from an out-of-network provider unknowingly. Many people are unaware that just because a hospital is in-network doesn't mean all the providers who work there are. So even if you've done your homework and chosen an in-network hospital, you might still get a bill from an out-of-network provider who participated in your care. Finally, it's important to regularly review your policy. Coverage can change from year to year. Procedures that were covered one year might not be the next. Prescription drug coverage can change, and so can your network of doctors and hospitals. Reviewing your policy annually ensures you're aware of any changes and can make necessary adjustments. But the insurance companies won't remind you to do this. It's up to you to stay on top of it. They may also not be upfront about the fact that cheaper plans often mean fewer choices of doctors or hospitals and may require referrals for specialist care. In the end, remember this: health insurance is not one size fits all. What works for one person might not work for you. It's crucial to understand the intricacies of your plan, ask questions, and advocate for your health. Being informed is the first step to making the best decisions about your health coverage. Your health is too important to leave to chance. Having delved into the depths of traditional Medicare and Medicare Advantage, we've uncovered some truths. Traditional Medicare may offer more flexibility, while Medicare Advantage could limit your options. We've also shed light on the secrets that health insurance companies might prefer to keep under wraps. Remember, knowledge is power. Don't let hidden facts sway your healthcare decisions. For more insights and hidden facts about healthcare, subscribe to our channel.